let's talk about what I wish I knew before I got immediate dentures. Patient perspective. I'm the provider, but I've been along for the ride, witnessing this process for decades. So you want to know that immediate dentures are placed right when you get your teeth pulled out, okay? The denture is made prior to you getting your teeth pulled out, and it is made from an impression of your mouth. When we make these immediate dentures, we will take your natural teeth off. Whatever ones are, missing, we'll put a tooth there. The ones that are still there, we will remove that from the model and place a tooth there. And in arranging these denture teeth, we want to make them look aesthetically pleasing. But what I want to point out is that they are from your actual impressions. We have just removed the teeth off of those impressions. So you get your teeth pulled out. The dentist puts these dentures immediately into your mouth. They cover those extraction sites, and you're going to be bleeding into those. That's perfectly fine. That's perfectly natural. You will develop blood clots in the extraction sites, in the holes where your teeth came out. It's important to maintain those blood clots. They protect the inside surfaces of that wound so that your body can deposit blood cells there and build new tissue. So those blood clots are a good thing. You want to make sure not to rinse vigorously when you get your teeth pulled out and you've got that immediate denture in. You just want to swish very, very gently and then let it roll out of your mouth into the sink. You don't want to be spitting. You don't want to be swishing vigorously. You don't want to be drinking really hot liquids or anything that will be disruptive to all those new little cells. I had a patient earlier today, and she had said that a dentist had told her about a mouthwash called Peroxyl, that it had hydrogen peroxide in it. I was horrified. Hydrogen peroxide is, most of you know what it is. They use it on wounds, and what it does is it takes away the dead soft tissues. So hydrogen peroxide is kind of damaging to soft tissues, especially when you're trying to build soft tissues. So when she told me she'd been using that, I was not happy about it, because that's doing the opposite of what we want to do. I don't want to be taking away soft tissue. I want to be building soft tissue. So it's important after that 72 hours, when that swelling is going down, to still be very gentle with your mouth. Rinse very, very carefully, very, very gently. Like I said, let the water come out of your mouth. And you want to do that as long as those edges are tattered, edges of those extraction sites, and as long as you have sutures or stitches in your mouth. You want to be very, very gentle with your mouth so that you can heal well. You want to wear the dentures, okay? And they're not comfortable in the beginning. This is something you need to be prepared for. I mean, they shouldn't be stabbing the heck out of you. And if they are, you need to call your provider and get in and have that area adjusted. But they're not going to be comfortable because your tissues are raw. You have had, teeth pulled, and there's raw skin in there. There's raw flesh, and this is protecting it, but it's not comfortable to wear. And it also feels humongous in your mouth. So oftentimes when you first get immediate dentures, you might get a little bit of soreness in your cheeks and your cheek muscles, and even your lips will probably be dried and maybe a little cracked. Get yourself some, Vaseline or something with chapstick for your lips, because it's not a comfortable situation. You're gonna have excess salivation. So whenever we put anything into our mouth, that our body recognizes that as something that it needs to digest, and digestion starts in our mouth with the salivation process. So it takes a couple of weeks usually for your body to realize that there's something there that's not going anywhere. It's not being introduced to it, as a new thing. So that salivation will calm down. But it's good to have salivation when you wear dentures, because you need that kind of lubrication in between the denture and your tissues so that it can help seal against your tissues. So that's a good thing. Another thing you want to know about is bone spurs, okay, and bone slivers. I hear a lot of denture patients on here refer to any kind of bony thing in their mouth usually as a bone spur. But really what a bone spur is the pointy, edge of the bone that is still attached and is right there under the gum. It might be stabbing through the gum, especially against the denture. When they're attached like that, there really isn't anything you can do about it because it needs to smooth out. And sometimes the only way it smooths out is by this writing against it. And because there's really nothing for those bone cells to remodel and, keep that structure of that pointed bony area. So it takes some time, but eventually it'll just recede and shrink away. Bone slivers, on the other hand, are little shards of bone or a tooth sliver, little shards of broken off teeth that were left when the dentist pulled your teeth out. And people get pretty upset when this happens, but it's really quite a common occurrence. I even had bone spurs when I was a little kid and I had a tooth pulled. They're so tiny. They're so tiny, and it's not something that the dentist is really gonna go look for. You would be exposed to so many x-rays if they were looking for all the little bone slivers in your gums after they pull teeth. They usually can visibly see them and get them all out, but there's little tiny ones that will hide, and they will work their way out. Your body will not put up with those being in there. They want to get them out, and so it'll start to work its way out, and one day you'll be fine, the next day you'll be like, oh my God, something's pinching me, and it'll be a little bone sliver or tooth sliver that is in there poking from your gums into the denture and pinching the snot out of you. So when they're not attached and you can feel them, not trying to tell you what to do, but when I was a kid, I had one right here after having a tooth pulled, and I didn't know what it was. I just kept getting a little abscess right here. I went to the dentist, they pulled another tooth. It was not the cure. Kept getting this little abscess, and I started to feel something scratchy there. And I told my older sister, I said, I feel like something's sticking out there. And she looked in there and she grabbed some tweezers and she grabbed them and pulled it right out. And the next day I was fine and recovered. And I have a lot of patients that do that. So I'm not telling you to do that, but if I had a little sliver and it was movable sticking out of my gums, I'd go get some tweezers. Anyways, just saying. So you're gonna have bleeding. It's perfectly natural. Some people are going to have bruising, and like I can barely, put my knee the wrong way up against the chair or the table when I'm getting up from dinner, and I can bruise myself. Like I bruise so easy. I'm fair-skinned, and some people bruise easier than others. So you will see patients, and I've seen them on this platform, who are bruised all the way down and black eyes. Sometimes that happens, unfortunately. It's not as common, but it happens. I've had patients that were bruised all the way down here, from their eyes down, and then up here, and then down here, and then it will pull right down their neck there. So it's unfortunately sometimes part of the patient's process. So I think I've covered a lot of things. The dentures are gonna get loose. You're gonna have to have those temporary soft relines to tighten them up. And I think I've covered about that first week for you. And that's a lot of talking. So I'm gonna go to part 2. Okay, see ya on part 2.